I woke up probably about 1 o'clock in the morning, and I just put my hand up here and felt there was just an absolute void there. There was just nothing there. But I didn't think anything more of it and went back to sleep.
Every morning I ring Mum, and I used to joke that it was checking that you're still alive phone call. And this time it sort of turned out that it probably was that.
When we first saw Marilyn and her scans, we were quite worried. Her brain was under threat but not yet dead. The standard criteria at that stage suggested you could only give clot dissolving treatment up to 4.5 hours since your last known well time. So she was outside of the range of normal stroke treatment. On that morning, the stroke nurse gave me a call and said, "We've got this patient, Mrs. Jackson." I drop everything that I'm doing and go down in a hurry to the emergency department.
He came in, examined me and decided I probably needed to go on to a particular trial drug. And I was just all over the place. I didn't know whether I should have it or not have it or whatever.
I always put to the patient and their families, it's entirely your choice to participate. No pressure, it's quite voluntary. But if you were
my mother, I'd tell her she had to sign here and there. So that was enough for me. So I did sign the paper.
That medication worked completely in terms of the clot was completely dissolved on her follow-up imaging, which we performed several hours later.
I was absolutely surprised at the outcome. When I checked my discharge papers, it was 2 days.
It was a really quite a frightening time for us. Just a horrible situation to have both parents in this situation at the same time.
My stroke was in April and he died in the following June. He was in and out of hospital constantly and I was there by his side.
Dad's death would have hit her much harder if she felt that she wasn't able to be there for him in full capacity.
I look back now and think I'm so pleased that I was able to have those last few months with him and feeling okay, feeling really good.
After Dad died, Mum quite understandably was in a fairly low place, and I said to Mum that you owe it to Dad to live the best life you can.
We always wanted to go to see the Taj Mahal, but it was just too difficult to get there. Tina, my daughter, decided that we should go to the Taj Mahal just for Dad. I can remember seeing the Taj Mahal and thinking, oh, this is just magnificent. Noel would have loved it completely. But a little bit sad, and I found myself weeping a little bit, as I'm about to now, just in memory of Noel.
The last 15 years have seen an incredible change in stroke treatments, and that can't happen without stroke research. It's been really the greatest privilege of my professional life is to take part in some of this stroke research and see the difference that it's made to these patients that would without doubt be dead or in a nursing home, walk out of hospital within several days. There's no way that we could have done what we've done as a stroke trials unit without the generous support of people like you and the Hospital Research Foundation.
Seeing Mum with this trial drug and having such a positive outcome for her has really changed the way I view supporting a charity such as the Hospital Research Foundation. I absolutely endorse it, and I talk to people about it all the time.
We asked the oncologist who he would suggest as being the best medical research organisation to contribute to. And he was, without a doubt, said the Hospital Research Foundation, and that's exactly what I've done. I've never ever hesitated in wanting to continue, and will continue to do so for as long as I can.